I want to talk to you about something most people never question: a routine lab test. You get an order, you're told to fast, and you do the responsible thing. You stop eating, you skip your morning coffee, and too often you stop drinking water as well. You show up for the draw feeling lightheaded, dry mouthed, and proud of your discipline. As a brain doctor, I have to tell you this well intended routine can quietly push your brain and blood vessels into a danger zone, especially if you're over 60. Take blood pressure or heart medications, or live with diabetes. Your brain thrives on stability: stable blood pressure, stable oxygen delivery, stable blood sugar, stable hydration. When you drive fast for a simple lab test, that stability can vanish. Dehydration thickens the blood. Thicker blood moves more sluggishly through narrowed vessels and can raise the chances of clotting. Pair that with a night of poor sleep, a missed morning dose of your blood pressure or rhythm medication because you weren't sure if you could take it, and you've created a perfect storm. Higher morning pressures in some, sudden drops in others, unstable heart rhythms, and glucose swings. None of those are friendly to an aging brain. I've had patients tell me, "Doctor, I almost fainted at the lab," or "my vision blurred for a few seconds on the drive home." That's not just inconvenience, that's your brain asking for help. And here's the most frustrating part: so much of this risk is preventable with a few clear habits and a conversation with your doctor before test day. Let's start with hydration. Unless your clinician explicitly tells you no fluids, water is not the enemy, water is protection. A well hydrated brain receives smoother blood flow, steadier pressure, and steadier oxygen. If your instructions say nothing to eat or drink, call and clarify whether plain water is allowed. Many standard fasting labs permit water. Sipping through the evening and a glass on waking can be the difference between a stable draw and a wobbly one. Next, medications. Never guess. Do not stop blood pressure medicines, antiarrhythmics, or blood thinners without explicit guidance. Skipping a beta blocker can invite a morning heart rate surge. Stopping an anticoagulant without a plan can raise clot risk. Taking it when it truly should be held for a procedure is also dangerous. The point is simple: your test should serve your health, not gamble with it. Ask, which medicines should I take with a small sip of water on test morning? Which should I hold and why? Get it in writing if you can. Diabetes deserves special attention. Going to a 9 a.m. blood draw after a late evening meal and then taking your usual diabetes medication can drive sugars too low. Going without the medication may let them climb too high. Both extremes are hostile to the brain. Your clinician can tailor a one morning adjustment, perhaps shifting dose timing, moving the appointment earlier, or allowing a measured glucose tab if you feel symptomatic. Don't improvise, plan. Sleep and stress matter more than people think. A restless night, anxious driving, and a long wait while dehydrated push up stress hormones and blood pressure. Build a calm runway into your morning. Set clothes out, bring your lab order, carry your medication list, and arrive with time to spare. Sit, breathe, and let your nervous system settle. Your brain will thank you. Movement is medicine even on test day. Gentle walking before you sit in the waiting area helps circulation without spiking blood pressure. After the draw, take a minute, stand up slowly, and be honest about how you feel. If you're dizzy, sit longer. Bring a small recovery kit, bottled water, an electrolyte packet without sugar alcohols, and a protein-rich snack you can eat as soon as your fasting labs are finished. Unless you're headed to a procedure that still requires fasting. Refueling smartly flattens those post-test dips that make the rest of the day miserable. Here's the larger mindset shift. Routine tests are checkpoints, not hurdles. They are supposed to lower your long-term risk by fine-tuning care, medications, nutrition, movement, but the way we prepare for them can create short-term risks we never intended. Aging well means controlling the controllables. Hydration is controllable. Medication timing is controllable with guidance. Appointment timing is often controllable. Ask for the earliest slot if you're fasting. Recovery after the draw is controllable. When you stack these small wins, you protect the organ that protects you, your brain. I've seen the difference these changes make. Patients who used to feel wrung out after labs now walk out steady and clear. Blood pressure readings stop yo-yoing. Glucose logs look calmer. The brain fog that used to follow a good strict fast disappears. That's not luck. That's physiology finally working with you, not against you. So before your next simple blood test, make a new plan. Clarify water rules, clarify meds, schedule early, sleep on purpose, move gently, rehydrate, refuel. You're not being difficult, you're being smart. Your brain is not fragile, it's resilient when you give it the conditions it needs. Don't let a routine day turn into a risky day. Prepare wisely, test safely, and keep your most precious asset, your mind, well protected. Many people think that fasting for a routine blood test means consuming absolutely nothing, not even water. They go to bed, wake up early, skip breakfast, avoid coffee, and most importantly, they don't drink water because they don't want to ruin the test. While their intentions are good, as a brain doctor, I can tell you this: dry fasting before labs, especially for older adults, is a hidden risk that can compromise brain health and even trigger events like strokes. Your brain depends on blood flow to deliver oxygen and nutrients at a constant, steady rate. When you dehydrate yourself by not drinking water, your blood becomes more viscous or thicker. Thick blood flows less efficiently, and if you already have some degree of arterial narrowing or plaque buildup, which is common after age 50, this reduced flow can set the stage for clot formation. Clots are what lead to strokes. Dehydration also causes blood pressure to fluctuate. For some patients, blood pressure drops suddenly when they stand up, orthostatic hypotension. For others, particularly those on blood pressure medication, the body may overcompensate, resulting in a spike in blood pressure. Both extremes can be dangerous for your brain. It's important to understand that most routine fasting labs do allow water. In fact, many clinics encourage patients to drink water so that the blood draw is easier and safer. But instructions are often vague, leading people to err on the side of total deprivation. That's why I tell all my patients, always clarify with your healthcare provider whether you can drink water before your labs. Unless you are having a specialized test that requires zero fluid intake, sipping water the evening before and in the morning will usually make your labs more accurate, not less. Water helps maintain stable blood volume and pressure, making you less likely to feel dizzy or faint during the draw. This is particularly important for older adults whose autonomic nervous systems may not respond as quickly to blood pressure changes. I've had patients nearly collapse in the lab chair simply because they were dehydrated and their blood pressure bottomed out. That can be prevented with a few glasses of water. Here's the takeaway: dry fasting is not a badge of discipline, it is a risk multiplier. Hydrating before your lab appointment is a simple step that can protect your brain, stabilize your vital signs, and even make the lab technician's job easier. If your lab order says nothing to eat or drink after midnight, call the clinic and ask, does that include water? That 30-second phone call can be the difference between a safe blood draw and a dangerous one. Your brain thrives on stable, predictable conditions. Dehydration disrupts that stability. Drinking water before your fasting labs is one of the easiest ways to keep your brain and the rest of your body safe. One of the most dangerous mistakes patients make before routine lab tests is stopping their regular medications without asking their doctor. Many people think, I'm fasting so I should skip my pills too, or maybe my medication will interfere with the results. But guessing about medication timing can be dangerous, especially for older adults or those with chronic conditions. Medications like blood pressure drugs, blood thinners, and heart rhythm stabilizers are critical to keeping your cardiovascular system stable. Skipping even one dose can lead to big swings in blood pressure or heart rate. For example, if you miss your morning blood pressure medication, your pressure might surge. That extra strain on your arteries can increase stroke risk, especially if you're also dehydrated from dry fasting. Blood thinners are another area where guessing can be dangerous. Stopping a medication like warfarin, apixaban, or clopidogrel without a plan can dramatically increase your risk of clot formation. On the other hand, taking a blood thinner when it should have been held for a procedure can increase your risk of bleeding. This is why every patient should ask, do I take this medication with a small sip of water or do I hold it? The same goes for diabetes medications. Taking insulin or certain pills without eating can drop your blood sugar to dangerous levels, but skipping them entirely may allow your sugars to run too high, which can make you feel weak, confused, or even lead to a medical emergency. The safest approach is to call your doctor or pharmacist and ask for test day instructions. Write them down. For most routine fasting labs, you can take your morning medications with a small sip of water, but never assume. Your doctor may need to adjust the timing of certain medications to balance the need for accurate test results with the need to keep you stable. Remember, medications exist to protect you. They keep your heart rhythm steady, your blood pressure in range, and your blood flow stable. Skipping them haphazardly creates unnecessary risk. Your lab test is supposed to lower your long-term risk by fine-tuning your care. Don't let it create a short-term danger by guessing on your meds. People with diabetes face a unique challenge when fasting for labs. Blood sugar levels can fluctuate dramatically if you go too long without food or medication. I've seen patients arrive at the lab weak, sweaty, and on the verge of passing out because they took their usual insulin dose or diabetes pill but didn't eat breakfast. I've also seen patients skip their medication entirely, only to arrive at the lab with sky-high blood sugars. Both extremes can be dangerous. The key is to have a test day plan with your doctor. If your labs require fasting, ask for the earliest appointment of the day so you spend as little time as possible without food. Clarify whether you should adjust the timing or dose of your diabetes medication that morning. Your doctor might recommend a reduced insulin dose, skipping certain pills, or checking your blood sugar before you leave the house. If your blood sugar drops too low, you risk confusion, falls, or even a medical emergency. Low blood sugar can also mimic stroke symptoms, which can lead to unnecessary panic or ER visits. On the other hand, very high blood sugar can cause dehydration, blurry vision, and poor wound healing, all of which increase your risk during and after the lab draw. Planning ahead makes all the difference. Keep glucose tablets or a small snack in your bag in case you feel symptomatic. If your test doesn't involve anesthesia or a procedure, ask if you can bring a snack to eat as soon as your labs are drawn. Your brain depends on stable glucose levels, and your safety depends on having a clear plan for how to manage your diabetes on test day. Stress and sleep deprivation can be just as harmful on lab day as dehydration and medication mistakes. When you're anxious or rushed, your blood pressure and heart rate rise, cortisol and adrenaline surge. This makes your blood vessels constrict, your blood pressure spike, and your heart work harder. These stress responses can destabilize your brain, especially if you're older or have vascular risk factors. A calm, predictable morning sets the stage for safer testing. Plan ahead the night before, lay out your clothes, gather your lab order, and set your alarm with enough time to avoid rushing. If possible, schedule your lab appointment for a time that allows you to arrive early. Sitting quietly in the waiting room for a few minutes can help your nervous system settle before the draw. Deep breathing, gentle stretching, and even a short walk can reduce stress hormones and stabilize your blood pressure. If you're feeling anxious about the test itself, tell the lab staff. They can position you comfortably, explain each step, and allow you to lie down if needed. Sleep is just as important. One bad night can push your blood pressure higher and increase your stroke risk. Do your best to get at least 7 hours of sleep before your appointment. Avoid excess caffeine or alcohol the night before, as both can disturb sleep and leave you feeling jittery. Your brain performs best when your environment is calm and predictable. A rushed, chaotic morning full of anxiety can create unnecessary risk. Give yourself permission to take your time, breathe deeply, and focus on your safety, not just the test. Once your blood draw or test is complete, the danger isn't over. Many patients leave the lab still dehydrated, underfed, and lightheaded, which increases their risk of falls, accidents, and brain stress. This is especially true for older adults, who may already be prone to balance issues or blood pressure fluctuations. The best way to protect yourself is to rehydrate and refuel immediately after the test, unless you are heading to a procedure that requires continued fasting. Bring a bottle of water or an electrolyte drink and start sipping as soon as you're allowed. If your blood pressure or blood sugar tends to run low, consider an electrolyte solution with a small amount of sodium and potassium to restore balance quickly. Eating a protein-rich snack or meal will help stabilize your blood sugar and energy levels. Choose something balanced like Greek yogurt with berries, a small turkey sandwich, or a handful of nuts with fruit. Avoid sugary pastries or sodas, which can cause a rapid blood sugar spike followed by a crash. If you feel dizzy or weak after the test, don't rush out the door. Sit down, take your time, and let your body recover. Driving while lightheaded can be dangerous. If necessary, ask a friend or family member to come with you, or wait until you feel completely steady before leaving the clinic. Your brain and body just endured hours of fasting and stress. Rehydrating and refueling is not optional, it's essential. It restores your blood volume, stabilizes your blood pressure, and gives your brain the energy it needs to function. Finally, the way you schedule your lab test can dramatically affect your safety. Many patients choose an inconvenient time because it's all that's available, or because they don't realize how much the timing matters. For older adults, scheduling your test for the earliest available slot can reduce the length of the fast and minimize risk. An early appointment also means you're likely to be more rested and less stressed. Morning hours are typically cooler, quieter, and less crowded, all of which contribute to a calmer experience. If you're diabetic, this early slot becomes even more critical because it reduces the window of time you must manage your blood sugars without food. When you schedule your appointment, tell the clinic about your health conditions. If you are prone to dizziness, have a history of stroke, or take multiple medications, ask for accommodations. You may be able to wait lying down, have extra water available, or receive closer monitoring after the draw. Make a checklist the night before: lab order, medication list, water bottle, recovery snack, glucose tablets if diabetic, and someone to accompany you if you feel unsteady. This level of preparation is not overkill, it's smart, and it reduces stress. When the test is finished, stand up slowly, drink water, and assess how you feel. If you're lightheaded, wait a few minutes. There's no prize for rushing out of the clinic. Your safety always comes first. Scheduling strategically and preparing intentionally transforms a routine lab test from a potential hazard into a simple, controlled checkpoint in your health journey.